Hello and welcome to this video. In this update, I want to give you some data about reduced transmission that we're seeing with some of these vaccines as new data is emerging, some good therapeutic evidence for treatment of COVID-19. I also have a very important update for women regarding the timing of vaccinations. Stay with me. I think you will find this very helpful. All right, so quickly here, we'll just look at Canada. You can see that most provinces in Canada are on a definite upward trend and hospitalizations are following, and we have a very complicated situation, especially in Ontario right now. They are setting up field hospitals and considering recruiting the Red Cross and other healthcare professionals from other parts of the country to deal with what is going on there. I would like to draw your attention to the Atlantic provinces. Down here, you can see that they have been fairly flat. So the Atlantic and Maritime provinces have not chosen to what I call dance with this virus. As soon as there are cases, they find out where they are, they track them, they have a lot of rapid testing, and they do lock things down fairly quickly. And the result of that is what you see here. They are not following the same curve as much of Canada. Now, the territories have also been fairly protected as well, and there's other factors at play there. But I just look at this, and I mean, look at the success that Atlantic Canada is having. And I don't think that this is not something that is attainable for the rest of Canada. But that is the situation this week that we find ourselves in. So, facts for a new pandemic. I did not create this title. I stole this title from an update that was created out of Ontario. Some top scientists there have come up with these new facts that they believe are important to public health and are important that the public be aware of. We see that governments are a little bit slow in adopting these principles or communicating them. And Dr. David Fisman from the Dalla Lana School of Public Health actually edited these, and he is quite reputable. He has been a source of incredible information during the pandemic, and so I have no problem having full confidence in sharing these new facts with you, because I think it's important that people be educated on this and that there be clarity. So they said, with the majority of COVID-19 cases in Canada now being variants of concern, it is time to update what we know. And we know these variants are now spreading around the world. We know that the P1 variant that originated in Manaus, Brazil, is in at least 41 different countries. The B117 variant is widespread, and the South African variant is quite widespread as well. Okay, so let's look at the facts. COVID-19 is airborne. The virus can be suspended in the air for hours and travel much further than 2 meters, especially indoors. The virus can be spread from someone who is infected but not yet showing symptoms, so asymptomatic transmission is what happens here, and those who are pre-symptomatic and those who never developed symptoms. The majority of cases of COVID-19 in Canada are now the variants of concern, which are 1.2 to 2.2 times more contagious and 60% more deadly. And that 2.2 may go up to 2.4 if we're talking about the P1 variant, which is accelerating in British Columbia right now. The highest risk individuals for COVID-19 in Ontario are now young, healthy people ages 10 to 39 years old. So we've seen quite a shift into the younger age group, and I'm sure that there are many factors for that, but the people that are ending up in hospital are also in the younger age group. A single dose of approved vaccines provides protection against severe illness, but you are not fully protected until 2 weeks after your second dose. The level of protection may change as variants evolve. You should still get vaccinated because you do have some protection about 3 to 4 weeks after your first dose, but you do need to continue following public health guidelines. And I will speak to that a little bit more as to why get vaccinated if the public health guidelines haven't changed. So stick with me for that one. Cloth masks do not offer enough protection from COVID-19 indoors unless they are lined with polypropylene. N95 masks or those with similar levels of filtration are recommended, and if you cannot get one of those masks, you definitely want at least a triple layer in your cloth mask for indoors. So when you're going to a grocery store, that type of setting. So most cotton masks will have a cotton, sometimes they have a second layer, and sometimes there's a little place where you could put a filter in there. And there were some good studies out of Hong Kong very early in the pandemic that showed even just a piece of paper towel acts as a good filter until it gets moist, and then you have to change it. This is because of the variants of concern that are so much more transmissible that we need more protection. Mask fit is crucial. Even small gaps reduce your protection. So getting a good fit around the nose, around the sides of the face here, not pulling the mask down. If the mask is loose on your face, sometimes you can twist the sides, the straps, to get a closer fit, and that makes a big difference. Outdoors is definitely safer than indoors. Transmission can be greatly reduced, at least 19 times, but transmission can occur in close or crowded conditions, and masking further reduces risk. And I will speak to risk outdoors very soon here. The seriousness of the illness that we are seeing now. Young, healthy people are deteriorating quickly at much higher rates. Brain disorders now affect 1 in 3 COVID-19 survivors. That's not necessarily new evidence, but they're just stating that this is now something that is known. We're seeing this consistently in the data, and it's now been accepted that this is what COVID-19 is doing to at least 33.3% of people. 1 in 4 people diagnosed with even mild cases of COVID-19 report long COVID symptoms months after recovering, and the death toll of COVID-19 is likely much higher than official numbers, as evidenced by the much higher than average expected deaths all over the world. So we know that this disease is affecting certain populations much more than others. And what we are seeing in different places of the world, but it's quite consistent, is that the people who are getting ill and the people who are dying are usually people who are essential workers. They work in grocery stores, they work in places where they do not have sick leave, and they work in places where they cannot just stay home. Also, these environments are often crowded, and one example of this was the Amazon distribution facility in Ontario a couple of weeks ago, where there was widespread transmission. So I wanted to share this with you because this shows this COVID-19 and social determinants of health. So there are a lot of different factors that play into the health of a society, and you can see many of these factors here, because when we think about health, we often think about just access to medical care, but there are a lot of factors that are involved. I thought you might find this interesting. Public health notice for women. Please schedule your mammograms either right before your COVID-19 vaccine or 4 to 6 weeks after. Thank you to Dr. Jennifer Kwan out of Ontario for this. She says possible temporary side effect of the vaccine is swollen lymph nodes, which could lead to false positive mammogram results. So if you are a woman, or if you know of a woman who is going to have her COVID-19 vaccine, please let her know. It may save someone some grief, and it's an important thing to consider when scheduling your mammogram. So why should we get vaccinated if life doesn't change afterwards? This is a common thought process, and I understand that many are struggling with this. So I wanted to talk about this. So right now, infection rates, especially in Canada and in other places of the world, are soaring, and these variants of concern are driving infection. So we are now in a situation where this virus is in all communities, and the risk is quite high, especially risk of severe disease. So that would be one reason to get vaccinated, because then your chance of developing severe disease is much less. The data that we have is actually showing that all of the vaccines currently approved in Canada, so Pfizer, Moderna, Johnson & Johnson, and AstraZeneca, are nearly 100% effective at eliminating severe disease, hospitalization, and death. So when you see those efficacy rates that are reported, those are regarding symptomatic illness. But when you look at the rates of severe infection, it's a very different analysis that we have to make. So I always like to point that out. Many vulnerable people still have not received their vaccine, and many people in Canada have only received one dose. So if you've had your dose and it was, say, a month ago, you do have some protection, but there are many other people that do not. And I'm going to talk a little bit about transmission after vaccination soon. The numbers are looking good, but they're not 100%. So by following public health measures, you are protecting those people who are more vulnerable, and either they have not had vaccination, or maybe they haven't had a good enough response or strong enough response to the vaccine yet. As case numbers go down and as community spread goes down, which it will as we have more vaccination, this will change. It takes 3 to 4 weeks for some protection post-vaccine. Full protection is only after your second dose. So the efficacy rates that you see are based on a 2-dose regimen other than the Johnson & Johnson vaccine, which is only 1 dose. And like I said, once community transmission starts to decline, some of these measures will gradually be loosened. And it's still unclear how much the vaccines reduce transmission, but I'm going to show you that. So there are a lot of reasons to get vaccinated, independent of the fact that you still need to follow public health measures, because we still have a pandemic raging on right now. But in time, and hopefully by summer, things will look a lot different if we do what we're supposed to now. And that's the part about vaccines are nearly 100% effective at eliminating hospitalization, severe disease, and death. For myself, I would gladly take a vaccine and have a little bit of a cold or not feel well for a couple days because of a COVID-19 infection than be hospitalized and intubated and maybe even die. So we need a little bit of perspective here, I think. Do vaccines reduce transmission? I'd like to thank Monica Gandhi. She is a medical doctor and has a master's in public health. And here is the QR link to this chart that I found very helpful. So if you put your phone onto camera mode and just put this up to your phone, this will take you directly to this graph if you're finding any trouble reading it here. So studies to date that showed COVID-19 vaccines reduce asymptomatic infection, otherwise known as transmission. So we have some good data. Look at these numbers here. Healthcare workers in England showing about an 86% reduction in asymptomatic transmission. So we know that the AstraZeneca vaccine is what was largely used in England. Patients at the Mayo Clinic Health System, about 88.7%. Healthcare workers in Cambridge University Hospital, so that's a very high risk area, 75%. And I think 75 looks like about the lowest. So those numbers are looking pretty good. They are not 100%, but they are looking fairly good, and that will be helpful in reducing transmission. So we do have evidence now that these vaccines do reduce transmission of the virus. And that is very, very important. That's going to help end this pandemic. Let's talk a little bit about ventilation, because this is a very important factor in all of our lives right now. I wanted to give you a little case study that I found online. Dr. Brooks Fallis shared this story, and I thought it was very important to share. So we have a case here of 6 people in a backyard for 2 hours. The next day, one person becomes symptomatic, and then they test positive for COVID-19. 5 days later, we have 2 more people from this group who test positive for COVID-19. One is now hospitalized and on 100% oxygen, and this is the B117 variant. And what we are seeing in growing numbers is that the things that we were doing with the original virus that was okay, these things are now becoming more dangerous because of these variants. And the patient said to their physician, "I thought outdoors is always safe." And outdoors is much safer than indoors, but it is not 100% safe. And the length of time that you're spending with people outside of your household is critical. We have to start thinking about viral load, how to reduce the viral load. And being outside is definitely one of the ways that we can do that. But if you are with people outside of your household, you should consider now, because of these variants that are so terrible, wearing a mask and also keeping your distance and maybe even reducing that visit or that exchange to a minimum. If you are in Canada right now, I know that the guidelines in most places are not to socialize with anyone outside of your household. So please do follow public health guidelines, because outdoors is not totally safe. It's better than indoors, but we are definitely seeing more and more transmission outdoors now. I'm giving you this graph here because I thought that it was good, a good reminder about how to maintain fresh air, filtered air, and flowing air in different places. And sometimes that involves just keeping your windows open. Other times maybe a HEPA filter would be helpful, and also keeping some kind of airflow. And if we can be conscious of this, it's one of the added layers that we can use to help protect ourselves and protect those around us from transmission of the virus. So I wanted to talk briefly about budesonide, otherwise known as Pulmicort in Canada. So there was a study on this. Now, budesonide is a glucocorticoid that we use for asthma, and it's usually in a turbohaler. It's like a powder. People just kind of lock in the dose, and then they just inhale it. And it's used to reduce inflammation in the respiratory tract. So a group of scientists have been studying this, and they are looking at this as far as an early treatment for COVID-19. We know that severe COVID-19 involves a very intense inflammatory process called cytokine storm that is very difficult to treat once it actually ramps up. They noticed that many patients who were hospitalized were not patients who were asthmatic. And so they started to think, why is this? And they started to study this budesonide. So this is a phase 2 randomized controlled trial, and their primary endpoint here was a COVID-19 related urgent care visit, including emergency case hospitalization. So they're trying to see if the use of budesonide in COVID-19 positive patients can reduce the need for hospitalization, and obviously that reduces severe disease. And their secondary endpoint was self-reported clinical recovery. So these patients were monitoring themselves for symptoms, and they were reporting these symptoms as well. And they had 146 participants. They started out with a few more, but this is what they ended up with. These were patients with chronic respiratory disease largely, or this study, like I said earlier, was because they noticed that these patients with chronic respiratory diseases were largely underrepresented in hospitalized patients. And maybe this was due to the use of inhaled glucocorticoids. So these were adults within 7 days of mild COVID-19 symptoms, and they were comparing inhaled budesonide compared with usual care. And that was the dose that they used there. The number needed to treat to reduce COVID-19 related urgent care cases was 8. So that means that they needed to treat 8 people with budesonide in order to prevent 1 person from going to hospital. And that's a fairly good number. There's other treatments that have been studied where the number needed to treat was 30 or 60 or 90. So this is a really good number here. Relative reduction of 91% clinical deterioration, similar to vaccination, greater than any other current treatments in use. This is not a substitute for vaccination, but it is very significant. And budesonide is widely available, it's safe, it's not as expensive as other treatments. It's not cheap for someone to buy, but it's not that expensive for people to use. So I think that it would be accessible to a lot of communities, a lot of people for treatment. Now, the study population was young, people with fewer comorbidities than patient groups known to have increased mortality, like maybe obese people, people who have diabetes or other chronic illnesses. So that is an important thing to remember, that this study was done mostly in young people without other comorbidities. But this is a new and effective option for treatment, and I would not doubt that this is being used now based on this study in some cases. A quick update for you on the situation with AstraZeneca in Canada. We did have one case of the clotting issue that was reported in different countries. We had our first case in Canada in the province of Quebec this week. To my knowledge, this person is at home and recovering. It's important to note that this clotting mechanism is, we can diagnose it and we can treat it with anticoagulants and immunoglobulins. So it is something that is definitely treatable, and that's what happened in this case. So Health Canada continues to investigate this, and they've done an independent assessment of the risk here, and they've concluded that these very rare events may indeed be linked to the vaccine. However, they do not believe that this is enough risk to restrict the use, because this incidence is so extremely rare. And the latest data that I saw is that the incidence in Canada is anywhere between 1 in 100,000 people and 1 in 1 million. So if you look at the risk of other things decisions or risks that we take in life, I will show you those in a minute. It is quite low. Oh, and that was a QR code there to the Health Canada update. In the very rare event that someone experiences unusual blood clots with low platelets, there are treatments, and like I said, there was a case of one woman in Quebec. So you can do a screenshot of this if you like. If you have received the AstraZeneca vaccine, you can watch for these symptoms. And if you do end up with a blood clot that is diagnosed, it is not recommended at this point from Health Canada that you receive a second dose of the AstraZeneca vaccine. The risk of blood clots from the AstraZeneca vaccine is looking like it's about 0.0004%. So with a regular birth control pill, we're looking at 500 to 1,200 cases in 1 million women. That's a much higher risk. Smokers run an even higher risk, and the case of a COVID-19 infection, about 165 cases of blood clots in 1 million cases, that's 16.5%. So this is a graph I thought was helpful to share. You can take a screenshot if you want, share it with others, it might be helpful. Another risk analysis here. So the chances of you suffering from an accidental injury or dying of a road accident or even being hit by lightning compared to the risks of a blood clot with the AstraZeneca vaccine. I'm sharing this not because I am an ambassador for the AstraZeneca vaccine, but I do think this is a highly effective vaccine. We have to trust the regulatory processes that Canada has. And also the pause on this vaccine and even the Johnson & Johnson vaccine is concerning because this has global ramifications. These vaccines are vaccines that you could take anywhere. They are fridge stable. They are not as expensive as the mRNA vaccines. And in Canada, we may have a choice to have other vaccines, but that is not the case for other countries. And this is significant. And as Canadians, this is something that we should really look at. We need to assess our risk, and we need to realize that the efficacy and the very, very small risk of these vaccines is so significant if we're actually considering pausing this. I wish they would look at how many lives this vaccine will save rather than the risk and the treatable risk that it does present, because I do think that pausing this will have global ramifications. A quick graph for you. We are in allergy season in many places right now around the world in the Northern Hemisphere, and some people might wonder if they're experiencing COVID-19 symptoms or allergies. I also made a video on seasonal allergies recently, and I'll put the link right up here for you. But I thought this might be helpful for you, and there is the QR code for that as well. You could just have that on your phone. And some resources that I use to stay up to date. COVID19resources.ca is a group that I'm actually part of, and this is a group of scientists and healthcare professionals from across Canada. We are volunteering our time to try to educate people about vaccines, and they actually host Zoom meetings. I think it's 3 times per week, 3 nights per week, where anyone from Canada can join, and you can ask your questions. You can ask experts. So we have different healthcare professionals, we have scientists, we have doctors and pharmacists and different people that jump on the call and are able to respond to your questions. So it's a very good place for credible information for you to ask your questions. COVID Vaccine Facts is also on Instagram, and they have some great infographics about the vaccines. Dr. Andrew Morris is an infectious disease doctor out of Ontario. He has a weekly email on Friday nights. I received this email, and I'll tell you, he has a great creative way of writing and also getting facts across, and not just pertaining to Canada, but pertaining to the situation globally. And so that is his email there to sign up for his weekly email. And if you are interested, it is always something that I do enjoy on Friday nights. He does keep it light as well. He puts a little bit of his humor in there and a few little links that you might enjoy. That's a picture of him. Health Canada is another resource. BC CDC and Immunize BC are also excellent resources as well. Thank you very much for joining me. I really hope that this has been helpful. If you're enjoying these videos, make sure you subscribe and click on the bell icon to be notified. I've kind of switched over into a COVID-19 update scenario here as we are seeing widespread COVID-19 infection across Canada. But I thank you for your time, and I hope that this has been valuable to you. I also hope that you do have a good weekend. Stay safe. Remember, outdoors is better than indoors, but it's not totally safe. We are dealing with some very serious variants of concern right now. So be wise, save lives, and stay healthy. Take care. Bye-bye.
Thank you so much for joining me. I trust you found this helpful. If you enjoyed this and you found it valuable, please subscribe and click the bell icon for notifications of future videos. I do put out at least one video every single week. And thank you to Heart Pharmacy for sponsoring this update and allowing me to continue making these videos and continue getting this information that is so vital to you.